Hi, everybody. Thank you so much for joining us today to learn more about Great Shakeout earthquake drill. But now, as we've done for years in the past, you're used to the shakeout. This year, we now have the complexity of COVID-19 pandemic to top that off. So we're hoping that you get some tips and tools and resources today and some great discussion. So looking forward to we want to let you know how to ask a question. So so you got to hear how to ask a question at the bottom. What we encourage you to do is to ask a question if you have one. We will take questions in the end, and actually we have an entire 30 minutes for questions, and allotted because that we know there are a lot of questions and comments in this is our third year doing this, and which is great. So questions are coming in, I can see, which is wonderful. The other thing, the questions we always get, so we want to put up those frequently asked questions always is, can I get the slides after the record, can I get the recording? Can I get the slides? We do have the slides in the handout section. We will send a follow-up email, and in the follow-up email, we'll actually have a survey for you, but also we'll send out the slides in a separate email. And the other thing is we now have a YouTube channel, so we'll also post this on our YouTube channel. So there's lots of ways, and I believe also it's going to be going on the Great Shakeout website as well. So there's many places for you to get the information, and we really, really do appreciate you joining us today. So I'm going to give it off to my colleague, Mark Benthian from Southern California Earthquake Center to talk about ShakeOut, because obviously we have a lot of changes, related to COVID-19.
Thank you, Nora. And really great to be here again this year to talk about ShakeOut, and particularly for healthcare organizations and participation. As we talk about ShakeOut and look on the next slide, that the history just last year, I'm not seeing it advance, sorry, okay. We had record-breaking participation across the world, the nation, and in states like California, Washington, and many others. And really, this is an opportunity for many different types of organizations to practice earthquake safety and other aspects of their emergency plans. And for many organizations, ShakeOut has been kind of an entry-level activity, something very simple. It can be very simple. It can be just a few minutes. Others do it as a full-scale exercise. Each year, it's on the third Thursday of October. This year, that means October 15th. But particularly every year, and this year in particular, we really message that you can really have your drill any day. So it's very flexible. It's not required to be on that same time. And everything about ShakeOut, of course, is on shakeout.org. ShakeOut's really based on social science research about what gets people motivated to prepare. And a lot of what we try to do is get people from many different organizations to be providing similar information about what to do. It may have different forms and look slightly different, but that's really key, that people see that consistency. They're not hearing one thing from one person, another thing from another person, and getting confused and not wearing masks or other activities. You can see how that consistency can be important. It's also key to see other people like themselves getting prepared. And if you think about right now, it's like seeing people wearing masks motivates people to see that perhaps is something they should do. And also it gets people to talk about preparedness, maybe in ways they haven't with people they know. And it's important to learn potential consequences when you're talking about those consequences, at the same time trying to avoid them. And we're trying to put all of that into practice for earthquake preparedness, just like all the other ways to get prepared. And our goals this year, as always, really starts with encouraging people worldwide to practice earthquake safety. Click. Also shifting the culture about earthquakes and preparedness. And then finally, we hope that that all leads to a really increased resilience at all levels. And the key thing is that everyone can really shake out. On the next slide, we see pictures of people in many different situations over the years, and from businesses to faith-based organizations to childcare to CERT groups to long-term health facilities and others, long-term care and families. And it really is something that you can make your own. ShakeOut's really been growing over the years, and we've started in Southern California. It has really as a one-time event and has grown across the country and around the world. And in particular, people are really using it. And then in some places, there have been earthquakes that have followed very closely even to ShakeOut. In 2018, there was an earthquake in Alaska. And I'll read it from the next slide, that a healthcare hospital emergency manager had a full-scale earthquake drill as part of ShakeOut. And just a few weeks later, there was an earthquake. That was in 2018. So that ShakeOut was, I think, October 18th or something that year. And so this earthquake was on November 30th. And while they had a good amount of damage and loss of utilities, this was a comment from, by the way, from someone who completed a survey after ShakeOut, and this is what they submitted. And they said that the staff dropped, covered, and held on during the actual earthquake, very few minor injuries. The staff directed to patients and visitors of what to do and even help protect patients during the earthquake. And that they really felt that the education of ShakeOut ensured their safety and allowed them to be better prepared. And really a key role aspect of this, to better prepared to then service the community and those injured from the earthquake. It's really important that healthcare professionals don't get injured before they have to help others. So why do we talk about drop, cover, hold on? It really is a strong consensus from firefighters and the urban search and rescue firefighters even that go to internationally, that people really, how they get injured in earthquakes for the largest percentage is because of falling objects and not collapsing buildings. Those, while that can happen, it's much more or it's much less common than things inside buildings falling, and actually things falling off of buildings on the outside. So if you're running outside, you're more likely to get hit by something that and as you're moving, to be hit by something than if you put yourself in a place where you won't. So we talk about drop, which will on the next slide. So in most situations in building types, we want to drop onto your hands and knees where you are. We don't want you to run down the hallway to get to some better place, or even too far at all. Your warning of the earthquake happening may just be really the start of the earthquake and no ramp up to it in terms of strong shaking. And so you can't get too far. So you want to get down where you are. And then next, you want to cover your head and neck with your arms and hands. And really perhaps just one arm and hand as you, if you do have a sturdy table or desk nearby, this is where you can crawl to it for additional shelter. And if there is no table or desk, you might get next to a really close by wall, or at the last, if there's nothing else to protect you, next to something that will limit how things are coming at you. And then you're going to hold on. If you're under something, you want to hold on to your shelter until the shaking stops. Be ready to move with it. And if you aren't under shelter, hold on with your head to your head and neck with both arms and hands. And it really is trying to get that arm and hand up as high over your head as possible, and so that you're protecting. Now, as we see on the next slide, we don't of course, not everybody can do these types of, oh, I'm sorry, I forgot about this. Here's another healthcare organization that, of course, you may have heard, everyone's heard about getting in a doorway. Well, that really isn't what is recommended and should never have been recommended. It doesn't protect you from falling objects or flying objects. And I'm talking furniture, equipment, TVs. Nothing is too heavy to be thrown or to fall during an earthquake. And because of ShakeOut, they knew actually how to drop, cover, hold on, and also how to educate team members with disabilities about what to do. And that's what I'm about to show you next. So if you can't get back up again, don't get down in the first place. And one key thing is that while this is particularly for people who may use a wheelchair or walker or otherwise can't do the normal procedure that is recommended, this could be any of us on any day. If we sprain our ankle or break a leg or or other thing that might happen, we need to know how to still protect ourselves. So depending on where you are, maybe if you're standing, sit down, bend over, cover your head and neck with your arms and hands. And it's really key that if you are someone who uses a wheelchair or other device, mobility assistant device, that you instruct others how to assist you. You don't want people dragging you from your chair down under a table, thinking that they're helping. That could actually, of course, cause more injury. So practice this with everyone. And at earthquakecountry.org/disability, we have guidance on this and other topics related to people with disabilities and other access and functional needs. So just some close up on here. Of course, if you use a cane, bring that cane with you so that as much as possible, so you can, if you do decide to get under shelter, you can use that to assist you getting back up. Next, and if you use a walker or rollator, if it has a brake, you can do that, sit on the chair, bend over. If it doesn't have a seat, more of a regular walker, if you can get lower than the handles of the top of the walker, that just is going to help protect, or things will hit the walker before they might hit you. And then if you use a wheelchair, also either set the brake or lock the wheels, bend over. If you have something that you have ready at hand that you can put up over your head, you might do that too. Then hold on during the shaking. Now, as on our next slide, we see we have a set of different videos that you can download at shakeout.org/messaging and also view on our channel at youtube.com/greatshakeout. What we're seeing here are still image, or not still images, they're animated GIFs of these videos, so shorter versions. And we do have a video showing what to do for people with disabilities, mobility disabilities, in something like 7 different situations and different types of devices. Okay, we also have on the next slide, we see a map or a poster really that you can order from FEMA. Not seeing it yet. Okay, I think there's just a delay. This is something you can order from FEMA, the FEMA warehouse. You can Google this, and it's a great poster of kind of showing different situations, something you can put up in your break room. And what you want to look for is this title, Protect Yourself During Earthquakes. It's a poster from the FEMA warehouse. Okay, so one aspect next is we ask people to register their participation, and it really is about, and people really want to be counted, they want to be included, they want to get the information we send out to the registered participants, they want to be listed, and it helps be that example that motivates others. And in the situation of the CMS requirements, this is a way that you might find other partners in the community that you can kind of have a community exercise with. And what we do with this information is, it's used to provide the number of participants each year in different regions, but also in the next slide, and this just click a couple times, we actually take that information, and at your option, we can list you. So we go from the regions and then click and then into the California, and then each category has a list of the participants. And we've had organizations say that they really like being listed there because, or even that they were able to convince their decision maker in the organization to participate because they showed the list of what other organizations are participating. And then if we look on the next slide, we can actually see the totals over the last few years, and the increase in healthcare, largely because we think of the CMS requirements and mentioning of ShakeOut in the requirements. So we've gone up by about a third and 200,000 or so just since 2017, and much more since earlier years. So now, in order to support ShakeOut participation, we do have a variety of resources. Whoa, this is a slide that came out very oddly. Sorry, but it's not meant to be looking like Klingon writing or something on here. But these do look better in other ways. And so we have flyers for different organizational types. We have drill manuals, posters you can put up, and materials that if you want to have t-shirts and mugs and these types of things for people, maybe like for your drill leaders, you can go to shakeoutshop.com. So all these resources made available. And one in particular are the healthcare ShakeOut resources. On the next page, we can see the drill manual for healthcare organizations that has been updated to include information about the CMS emergency preparedness rule requirements, and also the requirements for the different categories that are and how those vary. And Nora's going to talk a bit more about this after my presentation. We also have school ShakeOut resources. And by the way, that was at shakeout.org/healthcare, at shakeout.org/schools. I know there are some school participants participating today too. And so these are really great for both planning for your drills, general preparedness resources, educational resources you can use to include in your drill to talk about earthquakes. And we have a great connection with the Readiness and Emergency Management for Schools Technical Assistance Center, REMS-TA Center, there too. We also have messaging resources that you can use to communicate about ShakeOut to your employees, to your patients, to your residents, all the groups that you might want to communicate, even draft press releases, social media graphics and videos and animations. So you can get that at shakeout.org/messaging. Next, please. We do, if you are registered, we do send out email updates to all the registered, the people who register their organizations, that you can then forward these on to your participants. And this is actually, you can see from it's a mix of 2018 and 2019, and but you see the type of messaging coming out with great recommendations, not just for how to do your ShakeOut drill, but how to get prepared for earthquakes and even other disasters. Now, on the next slide, we also do have additional resources for seniors and people with disabilities and access and functional needs. We've taken our 7 steps to earthquake safety and adapted that with special considerations for the groups as in this document here. So again, you can get that at earthquakecountry.org/disability. Now, what about earthquake drills this year, given the situation with COVID, of course? We want to point out that, yeah, earthquakes likely won't happen at 10:15 on 10:15, the International ShakeOut Day and time. So you really can choose alternate dates and times for your ShakeOut drill. And doing that each year is good practice. So if you want to do it in the morning one year, you want to do it in the afternoon, you want maybe even in the evening. And also, earthquakes likely won't happen when everybody is together at work or school. So it's always good to encourage participation no matter where people are, whether it's at a school campus, in a hospital, of course, when people are at home or traveling. And so this year, with more people perhaps working from home or hybrid situations, having that drill happen no matter where people are is key. Just because they're home doesn't mean they shouldn't do an earthquake drill. And then also you want to consider supporting your ShakeOut activity remotely through video conferencing. So if you do have people who are teleworking, that you can involve them, or maybe everyone, some organizations, everyone's teleworking. So come together in a staff meeting and do your drill. You can see everybody dropping and covering under where they are, perhaps coming back up, and have a discussion about their earthquake safety and preparedness and plans. We are working on a simple PowerPoint to provide to all organization types to support that type of activity. And of course, if in person, for a drill, you want to follow CDC guidelines, ample space between people, PPE, hand washing, all the things that we should be doing right now. Now, I want to caveat that if an actual earthquake happened, you're probably going to want to react for the immediate danger, not the potential danger. Drop down where you are immediately, and you may, if you decide to evacuate, which may not always be a recommendation, you want to then do that perhaps with your social distancing and other measures in place. I do want to highlight that we are, because of this year, we are offering, the Earthquake Country Alliance is having our Safer at Home webinar series. And this is, while you see we're based in California, this really is not just a California messaging campaign. And next Wednesday, the 19th, we're having our second webinar called Plan to be Safe during and after an earthquake or other disaster. And you can find out about this at earthquakecountry.org/safer-at-home. You see we're kind of leading up to ShakeOut with what to do during, and then right after ShakeOut, what to do after. You can connect with ShakeOut and the Earthquake Country Alliance. The information is shown here on our websites. Email info@shakeout.org or info@earthquakecountry.org, and follow us on social media. My information is here. I am with the Southern California Earthquake Center at the University of Southern California, and also lead the Earthquake Country Alliance. My email, benthian@usc.edu, and you can follow me on Twitter at Mark Benthian.
Thank you so much, Mark. You gave us a world of information. And I know that we already have seen a few questions come in. And as we continue, we'll hope to have, if there's something that Mark said that spurred a question, now's a good time to put it in that question box. We want to make sure we and get to those questions that you may have. Our goal is to support you in knowing what to do during an earthquake, but also related to COVID. So again, I'm Nora O'Brien. I am the CEO of Connect Consulting Services. This is a little bit about me, but so I had the misfortune or fortune, if you refer to lead an H1N1 pandemic outbreak in 2009. Although a lot of people might say it might have been because it was not nearly as virulent as COVID-19, but we definitely got a lot of lessons learned. So a little bit about me. I founded Connect Consulting Services in 2009. I have a master's degree in public affairs and disaster emergency management. I'm also a certified emergency manager and a FEMA instructor. Also, it's not just me. It used to be just me, but we've grown and we lead a team of 10 highly skilled emergency management and business continuity professionals, and here to serve you. So today we're here going to talk about, COVID-19 and how it might impact your organization. So one thing that I know that this is a question why I put it on my slide, and then Mark also did the same thing last year. The first time we did this in 2018, we got a lot of questions from I need my certificate to prove that that I participate in the webinar, which means that counts towards my CMS emergency preparedness exercise. And so because we got that question, no, that's not the question, no, that's not the answer. So what does not count towards your CMS emergency preparedness exercise requirement is registering for the webinar. Because people thought, well, I registered, I'm covered, and I'm ready to check off that I've already done my exercise. And I'm saying in air quotes here. So that does not count. And also registering for the drill itself, that does not count towards your exercise requirement. What does count is actually completing the drill or exercise, and also writing an after action report. You know, currently we know with COVID-19, we're seeing a much reduced amount of CMS survey that's happening. But at some point, the surveyor's going to show up at your door. They're going to want to see proof that you actually activated your plan, and the COVID-19 and Great Shakeout are a great opportunity to think about. So kind of where we are in the pandemic phase. Some of you that have attended our webinars before, we include this slide in almost every webinar that we do, is because we're currently still in phase 5 to 6. You know, we're not gotten to the point, we're still at a high level of infection, and until we bring the flatten the curve down, we're unfortunately going to be in that phase for quite a while. But what may happen is when things go down, when infection rates are reduced, at some point we might get to that post-peak phase. And when we do, we might see additional rise in cases. And then at this point, we're also going to get to the post-pandemic phase. It's hard to believe, I know that I say this, you know, we've been at this for many months now, but at some point, you're not going to be talking COVID 24/7. Shocker, I know. But we think that the value of Mark brings, and what, you know, for you to think about the value of participating in a Great Shakeout with the conflict, you know, with the complexity of COVID-19, means that your organization is better prepared for any disaster, because there's so many operational decisions that you have to make, it so much that it'll impact your operations. The more that you kind of think of not just getting out of the building or just sheltering in place, depending on, you know, whatever the situation is, it means that you're better prepared for any disaster that may come your way. But so in terms of the pandemic phases, we're going to be there for quite a while, but currently. So for those, many of you that are on the call are healthcare providers that we're very familiar with, which it has to meet the CMS emergency preparedness compliance requirements. At the top there is the hot link in the header. That is the current CMS requirements link. They have changed over time, and we, because we work so closely with so many healthcare organizations, work very hard to stay on top of those changes. But so the core requirements have not changed. You have to conduct a risk assessment and develop a plan based on the risk faced by your organization. And that risk assessment, we happen to like the hazard vulnerability analysis tool by Kaiser. It's, you know, it's open source. It's a great document. Just Google it. I'm sure you'll find it. Kaiser Vulnerability HVA document. It'll pop right up, and it's a live open source tool for you to assess what your risks are for your organization, whether you're a healthcare organization, a school, a business, state agency, whatever may be. So you conduct that risk assessment and then develop your plan based on what those risks are. What that means is, you know, for planning purposes, is that we're based in Sacramento. We don't need a volcano plan, but, you know, if you're in Alaska or Hawaii, you absolutely do need a volcano plan or volcanic ash plan, as we did for one of our clients in Alaska recently. Yeah, and a tsunami plan, those kinds of things. So figuring out what those risks are faced by your organization and have a plan to address it. So the other thing is, one of the most recent requirements that have changed over the last year is CMS now requires you to have an infectious disease response plan. That's one of the newer requirements, and that came out in March of last year. So, you know, obviously just in time for COVID, how nice is that? The other thing is you have to develop, another key requirement is you have to develop policies and procedures. They vary by provider type. evacuation, shelter in place, MOUs with like facilities, etc. Those, basically if you're an inpatient provider, you have more requirements than if you have an outpatient provider. You have to create a communications plan. Everybody does. And you have to have redundant communication. The redundancy is, we know, we're currently in COVID, so we're lucky that we have internet. So that's one of the few events that you are dealing with. But if you're dealing with a COVID plus an earthquake, your power line's going to go down, cell towers go out, and you have to have redundant communication, and you have to know who to call and what to say. So that redundant communication is really geared towards whether it's a satellite phone or a radio, whatever that may be. But you have to have that plan. And then training and testing. So didn't quite know that we'd be doing as much testing as we currently are, but right now we have one thing that is a requirement that a lot of people are not aware of that's included in the regulation is if you activate your plan during COVID-19, it actually counts towards your exercise requirements. The exercise requirements, again, vary by provider type. So if you're inpatient provider like skilled nursing facilities pretty much has the highest standard of how often you have to train your staff, how often you have to conduct exercises, drills, tabletops specifically. But when you actually activate your plan and also write that after action report that we mentioned a minute ago with ShakeOut, it's an opportunity to count towards your exercise requirement. So, what better than an actual event? So we'll talk about that a little bit later. I want you to think about earthquake mitigation for your organization. Again, we talked about briefly knowing what your risk is. Obviously, believe it or not, a lot of people just think it's West Coast, but really there are some central parts of the country where there's significant seismic risk. We've also had earthquakes in downtown Manhattan that has happened as recent as a few years ago. So knowing that risk. So when you're before you even get ready for a shakeout, understanding what your earthquake risk might be. And what we highly recommend when you're doing it's part of your planning is to you can know your earthquake risk. And there's a link to the USGS. I'm sure it's within ShakeOut. We also can include that as well in the follow-up. But you can find out exactly what your risk is. You can put your address in, and it'll tell you what your earthquake risk is. The other thing on the mitigation is doing that walkthrough with your hospital or your school or where you are, and know even your home, because so many people are working from home, to identify what those things that are heavy pieces of equipment, furniture that are vulnerable for falling. Are there things like bookcases, a good example at home? A lot of people have things that are large dressers, china cabinets, etc. So those kinds of things. So do a walkthrough at your facility and understand what you can do to mitigate that risk. You're not going to completely eliminate that risk. And so that's where it works with planning is you're not just, you mitigate as much as you can. So if you can bolt things down, if you can do those kinds of things, great. And if you can't, then you plan for things that you can't mitigate. So also too, in a facility, very important to evaluate your infectious disease surge area, because that's the other issue too, dealing with COVID, whether you're a hospital or even a skilled nursing facility or even a, primary care clinic like a FQHC, you might have a specific isolation area, or you might have an isolation room, understanding that you want to, again, whether you're dealing with, you're not going to be dealing with just an earthquake, you're going to be dealing with COVID, plus like how you want to make sure to mitigate the spread of that infectious disease during you're figuring out what your response and your recovery might be. So figuring out that ahead of time, do you want to include an alternate care site? Is there a tent that you can set up? Is there portable HEPA filters, air scrubbers, IV pumps, or whatever? Where are they going to go? So thinking about how you can continue to provide care even though an earthquake has hit, and plan on how to evaluate, those, figuring out how to evaluate those, where you need to go and where those locations are going to be. Is that going to be in the parking lot? Is it going to be in, is it going to be a church parking lot across the street, et cetera, and figuring MOUs in advance. So other things on the mitigation, again, we talked about the strapping, latching, prevent cabinets from opening, storing heavier items on lower shelves, so they're, again, less risk of injury, especially in hazardous or flammable materials. I know, like in, good example, dental clinics and community health centers, like they normally wouldn't have a chemical spill or some kind of hazardous material spill. That's during an earthquake is one thing for you to mitigate from, but also, again, trying to deal with COVID as well. And those risks ahead of time, of identifying the vulnerabilities to your water lines, gas lines, electrical lines, understanding what you can do to mitigate that. And do you have a generator, and are you following a set of requirements on a minimum so that continue that operation, should that disaster, should that earthquake hit, and dealing with COVID. Also too, we talked about the communications tools that, multiple redundant communications for mass notification, a call tree, a radio, a satellite phone, blast email, social media, for communicating with personnel, other things that you can set up ahead of time that'll help you in dealing with COVID and also with should an earthquake hit. And provide not only preparedness training for your place of business, but also on personal preparedness. Again, so many people are working from home than they ever have because they've had to embrace it due to COVID. Understanding, does your staff know how to prepare their families as well? Because it's not just preparing in the workplace itself. Okay, on the response side, so in a healthcare facility, direct patients and visitors, very few visitors are allowed these days due to COVID, drop to the floor and under a piece of sturdy furniture, as we know, do that, drop, cover, and hold on, as we know. If furniture is not available, get it down on the floor and cover your head. When you're in this, if you're a patient or using a mobility device, a wheelchair or a walker, instruct them to lock the wheels and have them cover their heads. If the health facility is set up for infectious disease surge, related to a tent or your, whatever that may be aware of additional equipment that also might impact, that also might do some damage. So you got to be careful that may fall and cause injury. So you may not just have injury related to the building itself being damaged, but it might be people tripping over IV poles or whatever that may be. So those kinds of things are important. If the patient's in bed, try to roll them on their side and cover their head with a pillow. That's the other thing, because, like, what do? Put them under the bed? What if there's, it flattens them? So, so try to, as best as you can, give them a pillow for protection. Stay away, again, from the windows. If outside, move building, and overhead wires and trees, and making sure that you protect that head and neck. And then the other thing about on the response side, as it relates to it, you have to expect for aftershocks. We know, good example, Ridgecrest earthquake last year. We had a 6.4 earthquake on July 4th. Next day, we had a 7.3 earthquake, 24 hours later. So it was actually a pre-shock. So do know that those aftershocks may continue, so that might slow your response process down in trying to figure out how to deal with patient care and or, et cetera. So on the recovery side, check yourself for injury first. They always say take care of yourself first before you can help others. Then evaluate the area for injured people and damage to the facilities or equipment. If it's safe, check for people who might be trapped. nursing stations or space, any other kind of space. If you're in a school, is there someone stuck in the bathroom because the door, etc. All as the rooms are checked, you want to do as best you can to have that. If you're going to evacuate the building, you have to make that decision, having that critical understanding of, okay, do I deal with my ICU patients, with these critical COVID patients? What am I going to do? You're going to have to make some decisions. And so having an incident command system in place will help you to determine what steps you need to take, even initial steps, and having your staff train on what those incident command roles are. Ideally, you might be using incident command for COVID-19 response and recovery. Most facilities that we're working with are both in response mode because they're sometimes seeing a surge, but for the most part doing just mostly mitigation as best they can to mitigate that spread. Again, looking for possible broken glass, spilled fluids, chemicals, risk of fire, those kinds of things. And again, activate your plan and incident command systems as needed. So on the recovery side, evacuation may need to be an entire wing. It might be a whole unit that has, and it might be the whole building. So you need, again, to work with your safety team, work with your incident command team to figure out what that will be. Lines of authority, you might be working with the fire department, you might be working with Office of Emergency Services, OES in your community, might be city, might be county, etc. But finding out where that is. And it's also important to, should you have to evacuate, but whether you evacuate or you shelter in place, you need to have a system and a process for accounting of all patients and visitors, personnel during the evacuation. Are you going to be using triage tags? Are you counting people? Do you have a way to have, as part of your planning, have you already set up a system that you can track? Do you know where, can you get that information from badging? Because a lot of people have, external badges, whatever that may be. So that's important. Also, considering the types of vulnerable populations, especially are difficult related to COVID, pediatrics, neonatal, ICU, folks, senior skilled nursing facilities, figuring out if you are going to evacuate and what that potential act to evacuate, where you're going to evacuate them to. Are you going to be into the parking lot? Are they going to go to another facility? Are they COVID? Are they a COVID patient or are they a non-COVID? And you want to make sure that they are separating them out for those folks that do currently have COVID, or protection, the potential of that. And then again, safe measures of evacuation. So on the recovery side, recovery is a little bit, a lot of people think, oh, well, we get out of the building, we're good, we're covered, or we got the building back up. Recovery is kind of as the day is long. It's something that it can be, it can be a short-term process, or it could be, years and years. It just depends how extensive the damage is of the earthquake or any other kind of event. So depending on the size, it should be rapid, whether it's cleaning up debris, minor first aid, it's not just recovery is, it's safety is always the primary issues, but there's also the mental and the physical well-being. A lot of people don't quite understand sometimes when you're dealing with, long-term effects of disaster. These are tough on you emotionally. A lot of people think, I'll be fine. I made it through this disaster. I made it through COVID, or there's plenty of people making boatloads of money about t-shirts about pandemic, silly t-shirts about, how big their wine glass is, or wine time, or, coffee time. It's all pretty much the same. So that kind of thing. But think about, is there direct assistance, provided to you in regards of, shelter, supplies, can you work with your county health department, volunteer groups like American Red Cross or Salvation Army? And if it's applicable due to your incident, contact your insurance agency. A lot of people are like, oh yeah, well, that'll be very busy, but it's important to kind of keep track of what happened. And in the most severe disasters, federal government obviously is going to be stepping up. You know, they have been on COVID, and should there be an earthquake, your county, your state is going to be making that, or your state's going to be making that request to FEMA to say we need federal resources as well. The other thing to just kind of bring to your attention about a lot of people, when they think, again, they think physical recovery, understanding the signs of stress, you know, difficulty sleeping, limited attention span, you know, headaches and stomach problems, all those things are related to that, you know, that essentially PTSD related to that disaster of an earthquake, again, with complicated matters of COVID. So, you know, and stress can manifest it in the general population. You know, it's very much like, you know, impacts it could be anger. You know, your anger is really a factor related to PTSD. So it's just important to kind of get assistance and get help in figuring that out. And then acknowledging that it's going to take some time to get to a new normal. It's going to take some time with, you know, with an earthquake, and a large earthquake that impacts a lot of people. People have already kind of been feeling that with COVID. It's just important. And then the other thing is children are definitely impacted. For those of you that are schools on the line, children are a special concern because they, you know, they may not have the ability to process what's occurring, and you know, they might feel upset or confused or insecure or frightened or whatever that be. So taking special care with children, and also with ourselves, to know this is a tough situation. So those are the things, just to give you some considerations. Kind of want to wrap this up too, but and then we want to get to your questions because you have a fair amount of them, which is awesome. Know your facility, your school, your organization, and how you are serve your constituents now related to COVID-19. And what I mean by that is, do you have a sense, are you and your staff well aware of all the steps that you're taking to mitigate COVID-19, and then how that might impact related to an earthquake? For example, are you having more folks work from home, or that kind of thing? Are you having more people work from home? Are you having kids that are going to be in distance learning for part of the day, that kind of thing? Understanding, you know, how you're serving your constituencies related to COVID-19, and how that might be in an earthquake, you know, be more of a complication. The other thing is, know your constituencies, your patients, your staff, your students, and how you're addressing their COVID-19 needs. And so on the first bullet is really, what's your facility like? What is your building, and how the building, you know, if you currently are serving people in your building, and what kind of impacts of COVID-19, and how that would be more difficult. Like, you know, you can't just go get another school, let's go pick one up at the store. You know, you have to figure out another way to serve your students or patients, etc. So that's on the facility. The second bullet is really, what are the needs of your constituencies? The other thing is, we think that it's a great opportunity to use a great shakeout drill to test your emergency evacuation and also your shelter-in-place plans during COVID-19. It's not, oh, it's just another wrinkle and I'll just do a tabletop for the fun of it, but it gives you an opportunity to talk through those operational issues of what you need to think about, not just on the response side, but on the recovery side, to say, oh, what if we have to move to a new facility, you know, for 6 months? How are we going to do that? And it just gives you an opportunity. As much as you test your plans, it's another opportunity to make you better prepared overall for any kind of disaster that may come your way. The other thing is, that a lot of people don't always forget about earthquake planning, is you want to plan for the long-term effects. You know, should you be, you know, because what a lot of people think is, oh, well, the disaster's over in 2 or 3 weeks and we're good to go. Like, again, recovery is as the day is long, and Do you have like, it's an opportunity for you to think about, do I have an alternate location? Where can we, if we do have to move our school, if there's another, we can only treat people in the parking lot for so long, you know, that's going to work in the dead of winter kind of thing. So do I have an alternate location that I want to be able to identify? If you don't have that one, again, gives you an opportunity to think that way. So those are the big things. We have a bunch of questions. We want to be able to, let's see, here we go.
As always, we will be posting this presentation to our YouTube channel. So we will be sending out that link in an email afterwards, and so you guys can view it again or share it with anybody that you think needs to see this. We will also be including the PDF slides in this email, and also if you look in the handout section, we do have the PDF version of the slides with all the links that we talked about.
Yes. Okay. Oh boy, we got a lot of questions here. Okay. Here we go. How would a bed-bound person adapt to drop, cover, and hold on? Do you want to take that question, Mark?
Sure. So what we generally say for people who are in bed, whether bed bound or anyone who's just in bed when an earthquake happens, is to not get up and get out of bed. That research shows from past earthquakes that people who try to do that, to move, they're likely not wearing shoes, so they may be stepping into broken glass, and that generally things are falling and flying around. You want to stay in bed, cover your head, meaning with a pillow, is the general message. Now, of course, some people who are bedbound may not be able to do that. And really, it's how you prepare the environment that they're in, so to minimize things that might be falling on them in the first place. So equipment should be secured, TVs should be secured, and things like drop ceilings can be secured appropriately, even so that those tiles don't fall out. That's kind of depending on the person, especially if they're not able to take their own self-protective action. You want to, and this is really for anyone, if someone can't protect themselves, make sure that their environment is not going to hurt them as much as you can. One aspect that we often get is healthcare provider, a nurse or other who might want to kind of cover the person with their body to protect them. And generally that is not recommended, because you want the healthcare person to be protecting themselves so that they're then able to help many people. And if that person were to get injured, they would not.
Okay, great. Thank you, Mark. We have another question. Do you have any guidelines on how remote staff can participate in the ShakeOut? I've got some ideas on that. I would say that you can all do the ShakeOut. You could do a virtual tabletop exercise together, and you can all do the drop, cover, hold on, and then do a discussion. That's something I would recommend. What do you think, Mark? What else would you add to that?
Yeah, I talked about that with that we are even developing PowerPoints that will be on the website that can be used for those remote activities. We do that now for higher education, for instructors. We're making versions of those. By the end of this month, we'll have more of those that any organization can use. So an introduction to what the drill is, introduction to how to protect yourself. Then we also have a 1-minute recording of a narration of what to do with earthquake sound effects. So that can be played over Zoom or other video conferencing, and people can kind of do the drill together. And really it is those questions and that conversation that follows that can be really key. And not just thinking about the workplace environment, and where even if people are remote, you might think about, because you all work together, that place, but it's really important to be thinking about people's home environments and what they can do to be more earthquake safe, so that they don't get injured at home and come in as a patient versus as someone who's going to be coming in to help others.
Awesome. We have another question for you, Mark. Lisa's wondering if they do the shakeout drill after October 15th, but they finish it before the end of 2020, will they still be considered as a registered participant?
Yeah, you can have your shakeout drill any day of the year. The website even lets you specify what day you're going to have your drill, separate from October 15th, and many people do it on different days.
So go ahead and register. It will
Yeah.
still count. Just make sure you actually participate.
Yes.
We do have a question from Gloria. She's wondering if the materials that you were talking about earlier in the slideshow, or if they're available in other languages besides English.
Was that for me? They kind of cut out for a second. Say it again.
The materials earlier in the PowerPoint, she was wondering if they came in other languages besides English.
We do have a Spanish website for ShakeOut also. We have some of the materials in other languages too, especially the drop, cover, hold on graphics. And we're working on adding more.
A follow-up to that one is, are there training resources available for those who work with deaf or mute associates?
Not from ShakeOut and Earthquake Country Alliance yet. We have been focused so far on developing the mobility limitation guidance, but that is where we are heading, to have more materials in our website, fully accessible in different resources, having descriptive audio tracks and also subtitles on all of our videos. That's a couple of the different actions that we're doing. Multiple languages.
Sure. Question from Paula Larson. We use small stickers to mark our badges every day to show we've gone through COVID screening at our hospital. Any chance stickers can be made as one of the resources available to us the day of the drill? I think the
yes,
question
that actually is available now at shakeoutshop.com. We had a lot of requests for things like that, so we worked with a preparedness supply vendor to post that for us. And so they have 1-inch stickers with the ShakeOut logo, and I said I participated, so they're very much like the I voted type of stickers. There's larger stickers, there's buttons, there's drop, cover, hold on stickers. There's a variety of things there too.
Okay.
I think it's like 500 stickers for like $10 or something.
Okay. Well, we do have until 10. We do have until 11:30. We still got some more questions. So how many risks do you need to have a plan for? Can you prioritize the top 3? That's a really good question, Stephanie Crow. Thank you. So the real question is, it depends on the risks faced by your geography of where your building is, where your location is, but also risk to your organization. For example, you happen to live, we're in Sacramento, we live in the highest flood risk in the nation. Darn sure we need a flood plan. We don't, like I said, don't need a volcano plan. So the hazard vulnerability analysis tool, I would say top 3, if you just had to where is likely to be an event, 90% of events are flood related because they could be related to a storm surge, a dam break, a hurricane, all sorts of other reasons, so those kinds of things. So flood should, I would think, probably be your top 3, part of your top 3. And then fire as well. Those are and then maybe active shooter or active threat, workplace violence. Those are probably the most popular. Okay. Where can I find the new requirements to have the response plan for community clinics? It's a question from Karen Kent. That is actually several places. It's in the CMS link that I sent to you, and it depends, it's in the CMS slide, which we'll send to you. And also, actually, you want to go to our next slide. I can share where that is. So we'll still come back to this. Don't worry, we still have questions. So what we've done is we actually have CMS Emergency Preparedness Compliance Toolkit that actually has all the requirements for FQHCs and all the other 16 CMS Emergency Preparedness Compliance requirements for hospitals, skilled nursing, dialysis, you know, primary care, hospice, home health, etc. And so the requirements, we actually have a chart and what those requirements are, and included in, we'll send that slide out in the requirements of, depends on your provider type, actually what policies and procedures you have to have in place, when your exercises, what has to be updated, that will go out as well. That's a good question. I have a question. How would you instruct a family member to be safe in their car while waiting for a patient? That's a good question, Mark. What would you say to that?
Sure. We actually have a video about that too, what to do if you're driving or if you're, I guess, if you're just parking. You know, one thing is if you're in a parking lot and there's nothing going to be falling on you, you should just stay in your car. Your car has suspension and shocks, so you probably won't even feel it as much as others. But if you are driving, you want to stop, you know, pull over, stop. You want to try not to be underneath something that might fall, but you don't want to get out, you know, of your car and you don't know what other drivers are doing. They may not. One thing while driving, you may not notice the earthquake. You may notice people reacting on the street or other drivers reacting before you even realize an earthquake's happening. So don't expect everybody to be, you know, properly coming to a stop and you know, just be wary of what others are doing, of course, still. If you're in like a parking structure, you know, that, and you're parked there and the earthquake begins, you really should still stay in your car and get down, but you can get down low, like over, bend over towards the passenger seat in case something were to fall on the roof. Getting out is dangerous because the car itself might start moving around between if there's other cars next to you. It's a really complicated, you know, depends on the situation type of answer, I know, but those are the general guidelines.
Right. We've got a couple more questions about, let's see, related, so about dialysis, because I know we have a number of folks that signed up about dialysis. So what do you do? How do you help a patient when they're currently connected to hemodialysis machine? That's a tough one. I would use this, my example is such as cover with a, you know, pillow as best you can, cover with, try to get them covered, because if they're connected to the machine, it's going to be, they're not going to be very ambulatory, and you again want to get them to cover it as best they can. If they can cover their head, oftentimes folks on dialysis are somewhat ambulatory, so that's a help. Anything else you'd add to that?
I think it comes back to planning ahead. So really looking at that station where the patient would be, making sure that there's nothing that could be falling on them, no debris, nothing hanging on the wall, or, you know, making sure that the station that they're actually going to be getting treatment in is actually a very secure section, an area before they even sitting down, so that you know that things aren't going to be falling, you know, hopefully not.
Right.
That's what I would add to that.
Yeah. So what's the day of the shakeout? We have that question again from Julie Jordan. That's the 15th, correct?
It's always the third Thursday. International Shakeout Day is always the third Thursday of October. This year, that means October 15. And again, you can have your grill any day of the year.
Right, for sure. Okay. So question about an after action report. Do you have a simple document or tool we can use. One thing that we wanted to share with CMS, they're not wedded to any one form or process, or however you want to write things down. We actually happen to use the tools in our toolkit. It's a really simple. We have some still ones, a little more complex ones that are after action report forms that are based on the Homeland Security Exercise and Evaluation program. HCEP you might be familiar with, and we just like them just because it gives us some, it's a guideline, it's not a Bible, as people like to say, but we definitely, we certainly like that one. So that's included in our toolkit. On the next slide, Teddy can move to, and we also have the CMS toolkit for those folks that are in healthcare. We also just launched our school toolkit. That the difference with the school toolkit, there's no healthcare references, of course, but it also includes a reopening plan, and also includes reopening planning considerations checklist, and also includes our compliance requirement, our CMS, our COVID-19 planning, pandemic planning response guide. So that's included as well. It includes hours of consulting, and you can go directly to our website and get that done. Let's see. What do you do if a patient is having open surgery during an earthquake? Wow, that's a really tough situation. Again, do what you can to protect the head and neck and the core, the open area from, again, a pillow or whatever necessary in order to protect them during earthquake. And again, make sure that you might have aftershock. So that's another issue as well.
I'll add something to this, that on the West Coast, maybe eventually elsewhere, but being developed now for the West Coast is what's called an earthquake early warning system. It is now live in California, coming to Oregon and Washington in the next year or so. And this basically is like a lumberjack calling timber. The tree is falling, the timber is letting people know that it's on its way down. So what the system is doing is it's detecting the earthquake has already started and the waves are on their way, and it's giving you a few seconds, maybe more depending if it's a large earthquake farther away, of notice that you can take an action. And one of the examples that has been used is an operating room that the instruments can be removed, or other actions that are appropriate can be taken, perhaps in a few seconds or more. That's what can be done. But that is something that that kind of currently is something you get a warning through your message through your phone. And one day there may even be something integrated into PA systems in hospitals, so that warning is kind of automatically sets off the alarms and alert.
Right. Okay, thank you very much. A couple more questions are coming in. Does our whole facility need to participate in the shakeout, or could it just be our safety committee to count towards the CMS exercise requirement? That's a tricky question. So the answer is, ideally, you really want your facility, your whole facility, to participate in the shakeout, even if it's just as a tabletop exercise, because again, you're thinking about what those operational issues are. So it depends again on your provider type, whether you just need to do a tabletop or a community-based full-scale exercise, and when it has to be done. But the question is, ideally, the more of your plan, the more of your committee, the more of your organization is involved in a drill or an exercise, the more prepared you are. Again, we understand, and I say that, I know we're in time of COVID and we're dealing with, doing can to mitigate the spread, take care of patients, et cetera. But yes, it can count towards your CMS exercise as long as you write the after action report. There's a question related to home health that we're going to answer, and then questions are still coming in. Okay, yeah.
We're a home health agency taking care of our patients at home. Any specifics to deal with that scenario? the reality is home health has a requirement, I believe, to do emergency planning for their home health patients. And so that's something that happens usually at intake, I would assume. And so it's really creating that plan for not only the patient, but also their family that they live with. And so really kind of goes back to what are the specifics, what the contact people that need to be alerted. You know, what are the mitigation strategies that, you know, if you're identifying rugs that are easy to trip over, tripping hazards, things, bookcases that are not bolted to the wall, it's really looking at those systems in the home that actually allow that person to be much more safe during an earthquake. And there's also a similar one from a hospice organization, what to do when your hospice team are out in the field and at homes. I think that speaks back to the communications plan in the EP requirements. And I'll tell you that is really understanding your hospice team, really, because they're actually out in the field, and that applies to home health as well. It's understanding how am I going to communicate, because cell phones might be down. So that's where redundant communications come in handy. Can people be carrying small radios? Or at least, you know, leadership can be tasked with having enough radios that if there are issues that you can go back to the office and grab one.
Right.
That may not be possible, but it's really thinking about how you're going to be able to communicate with your team and also your patients, because they need that
Right.
not only the communication, but they also need the support to say, I can't come right now, I'm going to reschedule for tomorrow, and being able to carry on that way.
Right. We continue to have questions coming in. I'm sorry to get a chance to introduce to you our great Director of Aging Services, Karen Garrison. She is our expert. She is our resident CMS Emergency Preparedness Compliance expert and wrote our toolkit and actually led our effort to get the toolkit done. So glad she was able to join us today. They had another good question that'll actually both related to ShakeOut and actually to CMS exercise requirements. How can a remote earthquake exercise be considered a full-scale exercise per the CMS guidelines? So let's say you're all doing it remotely. So the suggestion that I have is, that we would have is that you all do the stop, cover, and hold. Your staff all do it. Let's say you're doing it remotely. It's drop, cover, and hold. So if you're going to be doing that and you all do it at the same time, let's say you're doing it in your home, since you all work from home, it's harder to do patient care from home, obviously. But if you all do that, you count it as an exercise because you have people report out kind of what their experiences were in their homes. And again, that after action report is going to be what counts toward the exercise requirement. If you got further questions, I think we haven't had any more questions come in the last few minutes. What we will do is, some of you are starting to leave us, which is unfortunate. We have just a little bit more information we wanted to share with you all, is that we continue to do webinars because we have plenty of questions that come in on a consistent basis. And so we've got a couple other coming up in September. We're going to do one on wildfire. We're going to do one on medical surge, a few others. If you want other webinars you want us to cover, please let us know. So you can always go to that Connect Consulting /free webinars and find out what we have coming up. If you have some questions, you can always book time with us. We also have our monthly newsletter, so you can sign up there. But what we will do is take all the questions and we'll put them in an FAQ document, get them answered, and get them out with the slides that'll go out at least by tomorrow. But I think we're pretty much wrapping up here, but we really appreciate, Mark, you're always a valued partner to Connect Consulting, and we really look forward to seeing those numbers of everybody continue to participate in the Great Shakeout. We want to see even bigger numbers next year, but we truly appreciate you, and we thank you. Any last words, Mark?
Just thank you very much for hosting the webinar again this year. Our partnership is great, and look forward to, for everybody, you can email info@shakeout.org for any assistance you need with your drill and the resources you're looking for.
Great. And again, there's our YouTube channel.
Don't forget to just subscribe to our YouTube channel. We have past webinars on there that you can go through, all topics ranging from CMS guidelines, and actually last year's ShakeOut is on there too. Go ahead and subscribe, share this video.
Yes, definitely. And business continuity as well. So if you have future topics you want us to cover, include that in the survey that's going to go out immediately. And you'll also get for participating today an automatic certificate
For attending the webinar.
Thank you so much, everybody.